Today we are going to see about the temporomandibular joint. So temporomandibular joint is nothing but an articulation of the mandible with the base of the skull, especially over the temporal region in the mandibular fossa. So this joint is known as temporomandibular joint. So you can clearly see the superior articulating surface. This is the mandible and this is the temporal region, and this joint is known as temporomandibular joint. So it articulates with the articular tubercle above and mandibular fossa here, and here there will be a small suture line which is known as a squamotympanic suture. So this suture is known as squamotympanic suture. So these three structures, articular tubercle, mandibular fossa, and squamotympanic suture forms a superior articulating surface. And behind the superior articulating, behind the squamotympanic suture, a small area will be present. This area is known as the tympanic plate. So this tympanic plate serves as a non-articulating part of the temporomandibular joint. It can be asked as an MCQ, which is the non-articulating part of the temporomandibular joint is tympanic plate. So what type of joint is the temporomandibular joint? It is a complex bicondylar synovial joint. It is a complex bicondylar synovial joint. What is complex joint? So it has an intra-articulating disc. So this intra-articulating disc separates the joint cavity into upper compartment and lower compartment. So it is called as a complex joint. What is bicondylar joint? As we know, the head of the mandible is also known as condylar process. So the temporomandibular joint is a paired joint. So it has both the side it has a condyles. So the both condyles articulate with the mandibular fossa and it forms. So it is called as a bicondylar joint. And synovial joint. Why it is called a synovial joint? The joint cavity is filled with synovial fluid and it is called as a synovial joint. Now, what type of joint is temporomandibular joint? It is a complex bicondylar synovial joint. And it has two articulating surface, superior articulating surface and inferior articulating surface. So, superior articulating surface, as we know, the superior articulating surface is formed by articular tubercle. So, this area is known as articular tubercle. And what is this? Yes, it is mandibular fossa. One second. So this is articular tubercle and this area is mandibular fossa. And what is this suture? So it is squamotympanic suture or fissure. Yes, these three structures forms the superior articulating surface. And the superior articulating surface are articular tubercle, mandibular fossa, and squamotympanic fissure. An inferior articulating surface is formed by only one part, that is the head of the mandible. Only the head of the mandible forms the inferior articulating surface. Now, normally, the articular surface of the synovial joint is covered by what type of cartilage? It is mainly covered by hyaline cartilage. But in temporomandibular joint, it is covered by fibrocartilage. So, about the articular disc and the ligaments, you will see in the second part. Thank you. Please do like and share and subscribe.